Hi, my name is Mark Brinson, Doctor of Oriental Medicine, Physical Medicine Specialist. You may have a fever and want to do some things naturally in order to reduce it. I want to talk to you just for a second about fever itself and the process that goes on so that you understand what you're trying to manipulate here. Fever is one of the body's first signs that something is wrong internally, especially if you have a virus or a bacteria that's at work inside you. Fever is important to have, though. As the fever starts to rise, there's certain things that you'll notice. You'll notice increased respiration, about 5 for every degree rise in the pulse. The pulse is also going to get higher, about 10 beats per minute for every degree rise in body temperature. And usually around 101, you'll start to get a nice little headache that goes along with it. This fever process is pretty important, though, because not only, in addition to providing an environment that's not so good for bacteria and viruses, they don't like to operate in that higher temperature, your body's also producing more white blood cells very, very significantly and trying to move them to the site of that infection that's being harbored inside the body. Now, while you want to let a fever ride a little bit higher. So for instance, maybe for an adult 102, maybe for a child 103 or so. There are times when you want to reduce it. So if it starts to get to 102 or above for an adult, 103 or above for a child, there's some things you can do to significantly reduce it. Obviously, you know, there's the things that you can do with over-the-counter medications. The antipyretics, such as aspirin, can be quite good. But if you want a couple natural remedies, for adults, you can take the top of the ear by finding the apex, just bend the ear forward, and the point right at the top, and gently stimulate that by pinching it, or you can prick it with a tiny little pin, letting a drop of blood go, and that not only reduces fever, but it also reduces blood pressure. In the child, coming from the back of the neck downward, in downward strokes, one way only. If you stroke very rapidly, 300 to 500 times, this can drop fever 2 to 3 points in just 3 or 4 minutes. If you do need to reduce fever a little bit quicker as well, you can put somebody into a tub of water, but don't use cold water. That can put the person into shock. What you want to use is a lightly warm bath, because even the warmth of the water isn't going to be over what their fever normally is. A warm bath is usually only about 98 degrees. Don't put them in cold water, it can induce shock. Now, with anything, if you've got a fever for more than a couple of days, you want to make sure that you check with your family physician. My name is Mark Brinson, Doctor of Oriental Medicine, Physical Medicine and Human Performance Specialist, wishing you a happy and healthy and balanced day.